Let's start looking at some of the individual muscles that you have to know. Let's start with muscles of facial expression. Notice on your sheet that lists the muscles that you have to know. I didn't list them all alphabetically. That would have been a horrible thing to do to you. Instead, I grouped them according to what they do and where they are. That's going to help a lot, all right? I'm pretty sure it will. So, Orbicularis oris. This is the circular muscle that goes around your mouth. See, orbicularis rather means circular, oris, oral, mouth. Now, as I said before, you have to know the actions of the muscles, and in most cases, I want you to use technical terms like flexion, extension, so on. In this case, I'm going to let you off the hook. A lot of these muscles of facial expression, they don't do precise flexion, extension, whatever, but I still want you to know what they do. So if I ask you for the action of orbicularis oris and you say it's the kissing muscle, I'll count that right. Because what happens when that muscle contracts? It makes you pucker up. There you go, see? In class, we would all be doing that right now. And people outside the classroom will be thinking, what the hell is going on in there? Then frontalis. Where do you suppose you find frontalis? Yeah, on the front of your body. In fact, on your forehead, right? Now, really, technically, there's a muscle that runs from your forehead all the way to the back of your head. And that muscle is called occipitofrontalis because it runs from the occipital bone to the frontal bone. So technically, the name of this muscle, we really should say, this is the frontal belly of occipitofrontalis. But that's a lot of syllables and a lot of letters. And so normally we're comfortable with just saying frontalis. That's good enough. Now, what happens when that muscle contracts? It pulls your eyebrows up, looking like you've just been surprised, like, wow, WTF? So if I ever ask you the action of frontalis, you can simply tell me it's the surprise muscle. How about zygomaticus major? Where do you suppose this, what bone do you suppose this muscle attaches to? Yeah, the zygomatic bone. And it runs to the corner of your mouth. So what happens when this muscle contracts? It pulls the corners of your mouth upwards. And most people call that a smile. So if I ever ask you the action of zygomaticus major, you can simply tell me it's the smile muscle. Buccinator, remember your buccal region? So when buccinator contracts, some people say buccinator, I say buccinator. It pulls your cheeks inward, it kind of caves your cheeks in, which is kind of the way you look when you're whistling. We have someone in our class, by the way, who's really good at doing bird whistles. I know because I read all of your student info sheets. So that's you. If I ever ask you the action of buccinator or buccinator, you can simply say it's the whistling muscle, and I'll count that correct. Orbicularis oculi, a circular muscle around your eye. Yeah, what happens when you contract it? It makes you wink. So if I ever ask you the action, you can say it's the winking muscle, and I'm good with that. Corrugator supercilii. So if you look on the, on your right, on that person's left, above their eye, see the muscle corrugator supercilii? That muscle is right underneath your eyebrow. So when you contract that muscle, it kind of pulls your eyebrows down. Now at one point I said that was a frown muscle, and I had a girl in my class say that's not a frown, that's a scowl. And so we Googled it, and she was absolutely correct. So now I say it's the scowl muscle. When you crinkle your eyebrows, you give the the look. You give somebody the look with those crinkled eyebrows. That's corrugator supercilii, the scowl muscle. Zygomaticus minor. Well, zygomaticus minor once again runs from the zygomatic bone, but unlike major, which runs to the corner of your mouth, minor runs to your upper lip. So when you contract this, it pulls the lip up just on one side, which is kind of a snarl kind of a thing, all right? It's kind of the Elvis Presley kind of thing. Thank you, ma'am. Or Billy Idol. You probably don't know who that is. Nice day for a white wedding. He used to do that thing where he would pull one side of his lip up. So that's zygomaticus minor, the snarl muscle. And then mentalis. So remember, where is your mental region? So yeah, your chin. So mentalis runs from your chin, from the point of your chin up to your lower lip. So what happens when that muscle contracts? It pulls your lower lip down, and that's a pout. And we were good on that. I asked the same girl who corrected me about frown. She said, no, that is a pout. So I'm good. I think we're good on that. Risorius, so risa, That means smile, unfortunately. In this case, so it pulls it straight to the side. So risorius pulls laterally, straight laterally. And that's the kind of face that I say is a grimace. When you pull aside your body, to the side, kind of like monkeys doing their mad at you. That's the grimace muscle. So if I ever ask you the action of risorius, you can say it's the grimace muscle. And so what's that? Botulinum toxin type A? Botox? Yeah, Botox. So Botox is actually the most powerful toxin known on planet Earth. It beats everything else. It has what's called the lowest LD50 of any toxin known. What they do is they dilute it massively, and then they inject it into muscles. And what does that do? It paralyzes the muscle. Now, why would you want to do that? Well, there are people who want to make their face smoother and take the wrinkles out. So you can get Botox injections into your face, and that will take the wrinkles out. The problem with that is when you take the wrinkles out, you lose your ability to make facial expressions. I live up in Oro Valley, and I go to like the Safeway, and there are these women I see in line, sometimes men too, it's mostly women I think, and they have faces that are like sheets of glass. They're like perfect, sheets of rock. But, I mean, if somebody were to run over their dog with a car and they would scream, they wouldn't be able to make a face. If they won the lottery, if they won $50 million, they wouldn't be able to make an expression of joy. So it's kind of like they're like the how to recognize the moods of an Irish setter there. Happy, depressed, angry, pensive, excited, suicidal. If you get Botox, your face kind of always looks the same, which is up to you. I'm not saying there's anything wrong with that. I'm just saying that to me it looks kind of unnatural, but some people think it makes them look very pretty. And who am I? What do I know about being pretty? I'm certainly not pretty, so don't ask for my advice. Look in the lower right, you can see there's a little red line, all the wrinkles there. I think they sometimes call those crow's feet. So that woman is about to get an injection there of Botox, and that will take away the wrinkles. What muscle would that be? Can you remember? That would be orbicularis oculi. All right. Kind of like the emotions of Danny Trejo. Happy, excited, cheerful, irritated, tired, annoyed, troubled, angry, offended. Danny Trejo. Those Machete movies. Oh my God, are those awesome. You got to watch those if you haven't seen them. Machete Kills, and then there's Machete Kills in Space. Awesome. So what can you do instead of Botox? Well, you can exercise. That's a poor man's plastic surgery. But seriously, the muscles of your face are just like all the other muscles in your body. The more you work them out, the better shape they stay in. And the diagram on the right is actually from a book that came out in the 50s about exercises you were supposed to do in the mirror every day to work out your facial muscles. But it really is true. You know how you see sometimes old people and their face is like frozen in that like grumpy look? That's what happens when you don't make lots of expressions. So the thing to do is to really enjoy life. Be happy, be sad, be excited, be angry, whatever. Move those facial muscles. It really does work them out and keep them in shape. You'll end up being less wrinkled than if you didn't. And yes, aliens really do live among us. This is actually a famous person. I can't remember her name. She was married to an Italian billionaire, and he divorced her for a younger woman. So she got she got millions and millions in the settlement. So she invested a lot of that money in plastic surgery and Botox and stuff. And she thinks she looks really pretty. I don't know. I don't know. It's all a matter of opinion, I guess. If I saw her coming down the street, I would be frightened. Muscles that move the eyeballs. So really easy. Rectus muscles. In this case, move the eyeball straight up, straight down, straight to the side, straight to the other side. So medially and laterally, all right? The superior oblique originates on the sphenoid. Inferior oblique originates on the maxilla. You don't have to know origins, of course. But the other two muscles, so there's 6 muscles that move the eye. 4 rectus muscles, superior, inferior, lateral, and medial. And then there's the superior oblique and the inferior oblique. The obliques move the eyeball diagonally. The rectus move them all in a straight line. Okay, so you can see in the diagram there on the left. By the way, they have the obliques mislabeled. It's just even books make mistakes. So what they're labeling is the inferior oblique. That's actually the well, no, never mind. I see, they're just labeling actions. But you can see the four rectus muscles. They're like at the north, south, east, west. And then over on the right side, see where it says trochlea? There is the superior oblique muscle going through the trochlea. And then on the bottom, kind of on the left, see how there's a muscle running underneath the eyeball? That's the inferior oblique, okay? All rectus muscles insert, you don't have to know that. All oblique muscles insert, you don't have to know that either. You just have to know the actions. Okay, platysma depresses the mandible and also pouts. They call it the shaving muscle. So look in the lower right. See that big, platy means flat. So see that big flat muscle running from the chin all the way down the neck? That's platysma. That's the most superficial muscle of the neck. Many diagrams take that muscle off because otherwise you wouldn't be able to see the muscles underneath. So platysma, the most superficial, sometimes called the shaving muscle because men, when they take razors and go up their face, they run right along platysma. Occipitalis, we talked about this before, so in the lower right you can see occipitalis. They call it the occipital belly of occipitofrontalis. You can call it that if you want to, but I'm going to let you get away with just saying occipitalis. And since it's part of the same muscle that frontalis is, it also raises the eyebrows. The epicranial aponeurosis, another name for it is the Galea aponeurotica, is a big giant tendon. It's a sheet of fibrous connective tissue that covers the top of the skull and connects the two bellies of occipitofrontalis. So there you can see in the lower right that big white band across the top of your head. That's the epicranial aponeurosis, or you can also call it the Galea aponeurotica. Masseter elevates the mandible, so you can see again in the lower right. Masseter runs from the zygomatic arch down onto the mandible. It closes the jaw, elevates the mandible. That's one of your powerful chewing muscles. The other powerful chewing muscle is temporalis, which you can see in both the lower right and the upper left. That's the big giant muscle that goes over your temporal bone. That also retracts the mandible. That's a chewing muscle. The two pterygoids I'm going to take off the list for the summer. Those are attached to the pterygoid process of the sphenoid, and they cause the side-to-side movement. The medial and the lateral, they can contract individually on the two different sides of the head. So sometimes when you see people chewing, they have kind of like a circular motion to their chewing. Those are the pterygoid muscles that make that motion. So more muscles of the head and neck. Digastric, the word digastric means two bellies, and that's because it has two bellies. It elevates the hyoid and depresses the mandible. So it does both of those actions. If I ever ask you the action of digastric, you can say either one and you're correct. So what happens, sticking with digastrics for a moment, it runs from the mandible down to the hyoid. That's called the anterior belly. And then it runs from the hyoid to the styloid process of the temporal bone. That's called the posterior belly. Then there's a muscle called stylohyoid, and just look at its name. It connects the styloid process of the temporal bone to the hyoid. But wait a minute, didn't we just say that that's what the posterior belly of digastric does? We did, and that's correct. So both stylohyoid and the posterior belly of digastric run from the styloid process to the hyoid. So how can you tell them apart? Well, the stylohyoid muscle rather, is it's more superior, so it's further up. It's kind of like on top. Or another way is to look at the two bellies of digastric and see how stylohyoid is in between the two bellies. That's how you can always spot stylohyoid. It's in between the two bellies of digastric. Both originate, and you don't have to know origins insertions this summer. I'm taking those off the list. Why do we have muscles like this? For speaking and swallowing. So the hyoid bone, remember, is the only bone that doesn't articulate with any other bones. What it does is it anchors a whole bunch of those muscles in your neck. These are muscles that are involved in swallowing and in speaking. And so what happens, these muscles basically move the hyoid around so that it's not in the way of what other muscles are trying to do, okay? Very complicated. Lots of things attached to the hyoid bone. So it gets moved around a lot. While you're speaking and talking, hyoid is dancing all over the place. Omohyoid. Omo is a very weird root word, but it means scapula. So omohyoid connects your hyoid to your scapula. How crazy is that? Damn! So look, you can see down in the lower right, going from your hyoid is a muscle all the way out to your scapula. So what would be the action of that? Well, it's going to pull the hyoid down. It's also going to pull the hyoid back, so it also retracts the hyoid. So if I ever ask you the action of omohyoid, you can say it depresses the hyoid. It also retracts the hyoid. Sternohyoid, how easy is this? It goes from the sternum to the hyoid, all right? Originates on the clavicle and the sternum, goes straight up to the hyoid. What happens when it contracts? It pulls the hyoid down. Easy peasy. Once again, used in speaking and swallowing. And the muscle that has the coolest name and the longest name of any muscle in the human body is sternocleidomastoid. Sternocleidomastoid runs from the mastoid process of your temporal bone, that big knob behind your ear, runs all the way down to both the sternum and to the clavicle. So what does it do when it contracts? It pulls your head. It pulls your head towards your sternum and your clavicle. So if the sternocleidomastoid, contracts only on one side, that will turn your head to the opposite side. So if your left sternocleidomastoid contracts, it causes you to turn your head sort of down to the right. And the right side one does just the opposite. If both of them contract simultaneously, it simply pulls your head down when you're bowing your head. And of course, we know the name for that action. That would be flexion of the atlanto-occipital joint. Okay? Laterally extends and rotates the head to the side opposite the muscle, originates on the sternum and clavicle, inserts on the mastoid process. You don't have to know that again because summer we're cutting some corners here. And muscles of the head and the neck continuing, all right, remember these are grouped in categories on your sheet, muscles of the head and neck. So a couple of important ones here. Splenius capitis extends and hyperextends the head when both are contracted, and then rotates the head when only one is contracted. Kind of like sternocleidomastoid, you can do both or only one. If you do only one, it turns the head. If you do both, it either pulls your head straight forward in the case of sternocleidomastoid, or pulls your head straight back in the case of splenius capitis. Originates on the spinous processes of vertebrae C7 through T6. But you don't have to know that because this is summer and we're in virtual education, so we're going to try to make it at least a little bit easier. Now, an interesting thing, splenius capitis, sometimes, we talked about Botox before, sometimes people who get migraine headaches, this is one of the muscles involved. You get a lot of extra tension in this muscle, because this is kind of what holds your head up during the day. If it weren't for splenius capitis, your chin would be on your sternum all the time. So this holds your head up, and so this muscle can be under a lot of tension. It gets a big workout, and sometimes people with migraines, this can be a source of the trouble. So they'll do Botox injections into splenius capitis to take some of the tension off. And I had a girl in my class a couple of years ago. This is kind of funny. Even she thought it was funny, okay? So she'd been getting Botox injections in her splenius capitis, and it was helping. She was not having nearly as many migraines. And she changed doctors, and the new doctor used a different dose, and it was a larger dose than normal. So he injected too much Botox into her splenius capitis. So remember, what's the action of splenius capitis? It extends and hyperextends the head. So what happens if you paralyze it? It means you can't extend or hyperextend your head, therefore your head stays flexed, and your head, you basically walk around with your chin on your sternum. And that's what she had to do for like 10 days until the Botox wore off enough. But she would walk around with her chin on her sternum. She couldn't even see where she was going. She would have to like put her palm on her forehead and like physically lift her head up to see where she was going. Or, you know, somebody would say hi to her. She'd have to like lift her head up and go, "Oh, hi, it's Karen. And I want to see the manager." So, anyway, we'll continue with more muscles in the next one.